Imagine your child wakes up one morning and everything about them is just different. They're terrified to touch things. They start washing their hands until their hands bleed, or they suddenly develop these violent tics and involuntary body movements. They're having panic attacks or rage outbursts that make no sense and are totally out of character for them. One week, they're a thriving, happy, healthy kid, and then the next, it's like their personality has been hijacked. Now, imagine being told that it's just behavioral, or that it's anxiety, OCD, or defiance. But deep down, something feels off. You know there's something else underlying. Because sometimes it isn't psychological at all. Sometimes it starts with something as ordinary or as seemingly harmless as strep throat. PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders associated with strep infections or streptococcal infections. It's a condition where a simple strep infection, the same kind that causes sore throats and the white spots in the back of your throat, triggers an autoimmune reaction that targets the brain and the basal ganglia. This usually affects children between the ages of 3 and puberty, and it happens very suddenly within like 24 to 48 hours. Parents often describe it as an overnight personality change. We're talking about kids who become consumed by obsessive fears, develop severe separation anxiety that they did not have before. They might stop eating or show motor and vocal tics that weren't there the day before. And it's not rare in the way that people think. It's just rarely recognized. When your immune system fights strep, it creates antibodies against it. Those are proteins that tag and then attack harmful bacteria. But strep bacteria have a sneaky little trick called molecular mimicry, where they disguise themselves with proteins that look a lot like their own cells. So after the infection, those antibodies can accidentally attack parts of the brain, especially the basal ganglia, which is the region that helps regulate your movement, emotion, and behavior. The result is inflammation in areas responsible for things like emotional control, impulse regulation, and voluntary motor activity. In MRI studies, children with PANDAS often show swelling in the basal ganglia, and clinically, it mirrors a condition called Sydenham's chorea, which was once known as the rheumatic fever of the brain. In both, the immune system attacks the nervous system after strep. The difference is that in PANDAS, it manifests primarily as psychiatric symptoms. This is the part every parent, teacher, and clinician needs to hear. The earlier we recognize and treat PANDAS, the better the outcomes. When a strep infection goes untreated, or if antibiotics are delayed, the immune system stays active longer, giving those cross-reactive antibodies more time to target the brain. That's why a simple sore throat in a child who later shows sudden behavior changes isn't just strep. It could be the start of an autoimmune storm. Early antibiotic treatment not only clears the infection, but may also reduce the risk of that immune cross attack from happening at all. And if symptoms have already begun, addressing the infection quickly can stop the progression and sometimes even reverse it. Here's where things get tricky though. There's no single blood test or MRI that can confirm PANDAS. Diagnosis is based on a combination of sudden dramatic onset of OCD, tics, or anxiety. A recent strep infection is a good indication. Neurological changes like movement abnormalities or handwriting regression, meaning their handwriting is going back to like when they were younger. And then also episodic course, like symptoms flare up after new infections or after sore throats. Because there isn't one definitive test, many clinicians mislabel it as Tourette's, generalized anxiety, or behavioral issues. And this is where the issue comes in. Others dismiss it entirely because of controversy. Some medical circles debate whether PANDAS and its broader cousin, PANS, which is pediatric acute onset neuropsychiatric syndrome, are distinct diseases or simply just a cluster of overlapping conditions. But for the families living it, it's not theoretical. It's real, it's terrifying, and it demands action. The good news: when caught early, PANDAS is treatable because treatment focuses on both the infection and the immune reaction. Antibiotics are the first line to eliminate the strep bacteria and prevent further immune response from occurring. And then anti-inflammatory medications like NSAIDs or corticosteroids can calm the brain's inflammation. And then in severe or recurrent cases, meaning if after infections in the future they continue to have symptoms, immunomodulatory medications, treatments like IVIG, which is intravenous immunoglobulin, or plasmapheresis, may be used to filter harmful antibodies out of the blood. Psychiatric support like OCD therapy and medication for anxiety or tics helps manage symptoms while the immune system resets. And sometimes recovery is dramatic. Within days or weeks of proper treatment, children who seemed lost to psychiatric chaos begin to return to themselves. What makes PANDAS so devastating isn't just the symptoms, it's the misunderstanding. Parents are told their child needs discipline or therapy or behavioral modifications or psychiatric medication, while the underlying infection keeps raging silently beneath the surface. Families often bounce between pediatricians, psychiatrists, neurologists, and therapies for years before anyone ever connects the dots. And by then, the immune system has often launched multiple attacks by that point, each one leaving its mark. But when someone recognizes it early, when a clinician says, wait, let's test for strep, it can change everything. It's the difference between a child lost in chaos and a child returning back to their normal selves. PANDAS challenges the way we think about mental illness. It forces us to ask, how many psychiatric symptoms might actually have immune or infectious roots? What are we missing? We already know infections can cause encephalitis, tics, and even psychosis. PANDAS and PANS are reminders that the brain is not separate from the body. It's part of the immune system's battlefield. When the body attacks the brain, psychiatry and medicine must work together. So if your child, or a child you work with or know, ever changes drastically after a strep infection or a sore throat or a virus, don't brush it off. And if you or someone you love is struggling with severe anxiety, OCD, or emotional distress of any kind, or suicidal ideation, you can call or text 988 24/7, free, confidential support. Thank you for being here. I'll see you next time.